Welcome future nurses. Thank you so much for clicking on my video. If you find this information helpful, please like and subscribe. And today we're just going to review Planning Chapter 13 of Kozier and Erb's Fundamentals of Nursing. The introduction begins with defining what planning is. Planning is a deliberate, systematic phase of the nursing process that uses problem-solving and decision-making skills. It also uses assessment data and diagnostic statements, which are nursing diagnoses, to create goals and nursing interventions needed to prevent, reduce, or eliminate the client's health problems. Planning is a joint effort between support persons, other health professionals, and the patient. There are different types of planning. The first is initial planning, which is done after the initial assessment and based on the initial assessment. Next is ongoing planning, which is done at the beginning of each shift and is done as new info is acquired and based on the patient's response to care, which allows the plan of care to be individualized. And lastly is discharge planning, and this is based on the needs of the patient after discharge, and it begins as soon as the patient is admitted and requires comprehensive and ongoing assessment. Developing nursing care plans. A nursing care plan is the end product of the planning stage of the nursing process. There are different types of nursing care plans. The first is an informal nursing care plan, which is an idea in the nurse's mind about the plan of care that she'll provide to her patient. Next is the formal nursing care plan, which is a written or computerized guide for care. And a standardized nursing care plan is a type of formal nursing care plan. And a standardized nursing care plan specifies care of a group of clients with common needs. So if you have patients that have pneumonia, there's a standardized plan of care for patients with pneumonia. So that standardized nursing care plan can be implemented for all patients with pneumonia. Next is a multidisciplinary nursing care plan, which is a type of standardized nursing care plan. It can also be called a collaborative nursing care plan or called a critical pathway. It details the care that must be given on each day during the expected length of stay of your patient, and it also includes medical treatments to be performed by other healthcare professionals. That's why it's called the collaborative or multidisciplinary nursing care plan, because it includes other people. But it does not specify nursing activities, so nurses can refer to the multidisciplinary nursing care plan just to see all the care that the patient may be receiving, but they need to also always use their standardized nursing care plan, which will detail their nursing activities and the nurse's plan of care for the patient. And lastly is the individualized nursing care plan, which meets the unique needs of your patient that cannot be met by using the standardized nursing care plan. Standardized approaches to care planning. Protocols are actions commonly needed for a group of people. Primary care provider orders and nursing interventions are also protocols. Policies and procedures govern the handling of frequently occurring situations, and a standing order allows nurses to carry out certain actions under specific circumstances, such as having a standing order for an antiarrhythmic medication that can be used for patients that go through cardiac arrest, and there can also be a standing order for oxygen for any patients that have any difficulty breathing, for instance. The planning process has 4 steps. The first step is setting priorities. You want to make sure you include the health values and beliefs and priorities of your patient. You also want to consider the resources available and the urgency of your patient's health problem. Next, you want to establish goals and desired outcomes. You want to make sure that they are observable client responses. And a goal is usually broad, and then the desired outcome is specific. An example of a goal is the patient will not acquire an infection, and an example of a desired or expected outcome is patient will demonstrate proper hand washing technique. So you usually have one broad goal, and then you have multiple expected outcomes that when reached will help you reach your goal. Next, you want to select nursing interventions, which can be independent. Independent nursing interventions are interventions that can be done by the nurse by themselves. They include physical care, ongoing assessment, emotional support and comfort, teaching, counseling, environmental management, and making referrals. Dependent interventions require the physician's order, and collaborative interventions require other healthcare professionals such as a respiratory therapist or occupational therapist. And lastly, you want to just write your interventions. Make sure you always include the date when written, and you want to include a verb, a condition, a modifier, and time, and make sure you're always specific. An example is assess pain rating every 30 minutes until pain is rated under 6. The Nursing Interventions Classification was developed by the Iowa Intervention Project and published in 1992. It is updated every 4 years. It has 3 levels. Level 1 are domains, Level 2 are classes, and Level 3 are interventions. There are linked to NANDA diagnoses, and they are just suggested interventions according to NANDA diagnosis. Lastly, let's just review some important points. So the steps in the planning process are very important. The first step is prioritizing problems and diagnoses. The second step is formulating goals and desired outcomes. Third, you want to select nursing interventions. And fourth, you want to write the nursing interventions. And also remember that discharge planning begins as soon as the patient is admitted. Thank you so much for watching my video. If you made it to the end of this video, please like, comment, and subscribe. And please comment below any suggestions for improvement. And I just want to wish all the future nurses out there good luck.